They were all stroke patients, and they had aphasia, which is a language disorder where they have got all the words in their brain, but they have a problem getting to those words and forming them.
Well, I'm a graduate student in the College of Social Work, and we worked with other interdisciplinary teams. And we worked together to kind of find a plan that was workable for the patient and his family.
Each discipline came up with a different intervention. For example, social work and speech-language pathology were very similar, and some of them were drastically different. Like some of the PT interventions and assessments were very hands-on. So it was a really neat experience to be able to work together with a common goal, but have very different or very similar approaches.
They had a lot of aha moments about what the other professions could do, and it was great to see the other professions learn what a pharmacist could do. They didn't realize the pharmacist asked all these different questions that helped with the therapeutic management of the patients.
I think the ability of the students to watch what the other disciplines do and their approach was quite beneficial, and actually very much mimics real-world clinical care, where as physical therapists we have to interact and collaborate with many different disciplines.
I feel like communicating with other professions in the field helps us to provide the best care for the patient and ensure that they're getting everything they need and everyone's on the same page with things.
It was very convenient for the patient to be seen by all these professionals kind of back to back. And I think that if we all work together, that we can provide, optimal care for them and just be really convenient for them, which is really important when you're going through so much already.
We all had lunch together, and the students in the same discipline couldn't sit together, so we were all mixed up, which was nice because you never really meet anybody from the other disciplines unless you're part of a club or a student organization. So it's great to get to know people who you will probably be working with in the future.
We had a chance to kind of sit down and discuss in conversation with the other students things they learned as well, and so it was really helpful just to hear everyone's perspective and talk about it as a team.
And what people learned about each different discipline, I think that was the best part, because a lot of people didn't know what social work did and how they would be helpful in that situation. And I didn't necessarily know what people specializing in PT would do in that situation.
I've been doing this for 17 years. So I pretty much knew what the medications did and whatever, but I especially enjoyed working with the pharmacy student. My husband's case is very complicated, and so he's on a lot of medications. So I really got a lot from working with her.
The spouses really did get a good amount of attention, so it was good to see that happening.
We gladly did it because I felt like anything that help them would ultimately help us and other patients that had had strokes and disabilities as a result of it. These people that were interviewing Pat seemed really concerned, and I thought it encouraged me that there are people that care.
This experience is so needed for most of the professions here. I think they need to expand it beyond the workshop. I think we just need it so much. There's such a great need for it. We really just got to kind of push these workshops out more frequently.